So we'll continue with the second session, that is cardiac rehabilitation, a practical approach. So we'll talk about in this session, just a minute. Okay, so our objectives of this particular session is we'll talk about the third and fourth phase of cardiac rehabilitation, the type of breathing exercise in cardiac rehabilitation. We will discuss about the home-based cardiac rehabilitation program and what is the process of cardiac rehabilitation in any institute, and we'll discuss the various psychoeducation components of the cardiac rehabilitation. So just to begin with, we have talked about this, the all four phases of cardiac rehabilitation. Here we'll be talking about next phase, that is third phase of cardiac rehabilitation. Okay. The objectives of this phase is that there are two objectives are there. The first is functional, the second is psychological objectives. So in functional objective, the exercise training under the supervision is very much recommended in this particular phase, because phase 1, phase 2, and phase 3 are the supervised exercise program, while the phase 4 is a unsupervised exercise phase. Then psychosocial goals. Normally the work on the anxiety and depression is being carried out. I mean, the patient is being referred to the psychologist, where the literature also has stated that, the majority of the patient normally experience any kind of anxiety and depression during when they undergone any kind of, the major cardiac surgery, even they encounter with any cardiac event. So therefore, the anxiety depressions are the very common phenomena. Therefore, the patient are being referred to the psychologist to deal with the anxiety and depression. Then the another goal of this particular phase is that patient able to return to the work as soon as possible, and also they can have their own normal hobbies and the lifestyle. We talk about the research evidences on the impact of CR on psychological parameters. It has been proven that over the period of time, if the patient is continuously, it is following it is enrolled in the cardiac rehabilitation, and after the period of 8 to 12 months, the anxiety, depression, and hostility and other psychological parameters, they substantially reduced once they enroll into the cardiac rehabilitation program. And this particular phase normally remains for 6 to 10 weeks. And it's an individually tailored structured exercise training. So in cardiac rehabilitation, as such, there is no uniformity of instructions are there. For every patient, the cardiac rehabilitation program is very much individually tailored. And on the basis of risk stratifications, on the basis of the patient general condition, as well as how the patient is responding to the treatment, this particular program is being structured. Therefore, in beginning, the risk factor stratification is done so that the individually tailored program can be structured for the particular patient. Then exercise class will consist of warm-up, exercise class, and the cool-down sessions are there. And exercise prescription is basically based on clinical status of the patient, how the patient is responding to the treatment, what is the risk stratification, then how well the patient has performed the activities in previous 2 phases of cardiac rehabilitation, and what are the future needs, what would be the nature of work of the patient. So on the basis of these parameters, the rehabilitation program is designed for the particular patient. So this is exercise prescription, where the warm-up, the period of warm-up phase is normally increased, that is 10 to 15 minutes. The main exercise remains for 30 to 35 minutes, and cool down period normally it remains for 10 minutes, followed by 15 minutes of relaxation by any music therapy and by any methods the patient feel like. But the type of exercises, that exercise normally get changed from the second to third phases of CR, where patient, some of the exercises are sit to stand, triceps, push-up and pull-ups, knee lifts. Then walking, they can gradually increase for the more period of time, and then cycling, of course, the calf exercises. So these were a few exercises which were recommended in third phase of cardiac rehabilitation. And fourth one is maintenance phase. In maintenance phase, as I said, this is an unsupervised phase of cardiac rehabilitation. Therefore, the patient, when they be at their home, all the instructions, all the exercises which are being taught in first, second, and third phase of cardiac rehabilitation, they can perform these exercises at their home. Even they can opt at the center-based cardiac rehabilitation if they are not, like, they feel like they should be learning more about those exercises. Therefore, in some cases, they also can go to the center-based cardiac rehabilitation. But in majority of cases, patient normally perform these exercises at their home. The objectives of this phase is to maintain and achieve the functional status, return to the work as soon as possible, and return to the hobbies and lifestyle modifications. And when phase 3 is over, then the patient can continue their exercises and other lifestyle modification for the indefinite period of time. That means for lifelong, they have to perform these exercises, as well as they need to follow these lifestyle modification instructions, which is being given during the all 3 phases of cardiac rehabilitation. And patient can have a telephonic follow-up, and periodical follow-up can be also it is being done by the CR team. Then individual may prefer to exercise independently or at the center-based cardiac rehabilitation. And the purpose of phase 4 is to have a patient safe and the realistic maintenance program. Okay, coming to the breathing exercises. Basically, in the hybrid cardiac rehabilitation program, previously the breathing exercises were not included, but in hybrid model of cardiac rehabilitation, in some of the literature and the research articles, the breathing exercise have proved to be, these exercises have helped them to recover well and early, and patient could able to return to their normal life. Therefore, I could find only 4 type of breathing exercises, which was mentioned, which was specified in 1 or 2 articles, where use of these exercises, breathing exercises, help the patient to recover well. So these exercises are diaphragmatic breathing, pursed lip breathing, coughing exercise, and spirometry exercise. So spirometry exercise basically recommended in the first day of post-operative period. Then pursed lip breathing and coughing exercise are recommended in second and third phase, second phase of the cardiac rehabilitation, and the diaphragmatic exercises are normally recommended in third or fourth phase of cardiac rehabilitation program. Okay, coming to the very new concept that is called home-based cardiac rehabilitation program, because in our country, we have already talked about the various of cardiac rehabilitation program, and there are, n numbers of areas are there. Because of that, patient could not able to complete the entire phase, all phases of CR. Even they could not able to enroll in the cardiac rehabilitation program. The reason is because of geographical variations, because of transportation barrier, and especially the state like Uttarakhand, where the transportation and financial as well as the geographical barriers are very predominant. So in such case, the patient could not able to enroll in the cardiac rehabilitation program. And why I'm just mentioning this at this platform, because the Telemedicine Society of India can play a pivotal role in delivery of cardiac rehabilitation. I mean, the home-based cardiac rehabilitation to such patients, and more patient can be, benefited out of which. And I'll tell you, as I said in beginning also, the Rehabilitation Council of India, which is a very statutory body who is working for the rehabilitation in our country, does not endorse the cardiac rehabilitation in their domain. So there should be somebody, the statutory body or some, the societies who should take up this and should, have a plan for this, so that, the entire the draft of, or the plan can be shared with the government of India and the government, so that the home-based cardiac rehabilitation can be initiated in our country, especially the state like Uttarakhand, and more patient can be benefited. So home-based cardiac rehabilitation is an alternative to the center-based cardiac rehabilitation program, and mode of delivery can be done by telemedicine. And the main advantage is that some of the barriers which normally are the main cause of poor uptake of cardiac rehabilitation program, like geographic and transportation barrier, could be overcome by the home-based cardiac rehabilitation program. And if I was just searching the literature on the home-based cardiac rehabilitation program, to my surprise, there is no home-based cardiac rehabilitation exists in our country, and I could not find even a single center who just run the home-based cardiac rehabilitation program. And to the best of my knowledge, if it is existing, I would be happy to know if it is existing in our country, but still it is in very infancy state, and we should endorse it, we should take it, and we should we should be able to do it with the help of Telemedicine Society of India, so that more patient can be benefited at a time. And there are multiple empirical evidences, and home-based cardiac rehabilitation is a very common phenomena in Western countries, not in India. And they says that it increases the participation, and just, it helps in supporting the behavioral change. So this is about the home-based cardiac rehabilitation program. If we talk about the process of cardiac rehabilitation, first the patient normally get enrolled in the cardiac rehabilitation program. Then the detailed history and the physical examination or risk stratification is carried out for such patients. The patient is referred to the CR center. Then patient being, after referring to the CR center, their basic parameters, the physiological parameters are checked, like blood pressure, heart rate, and rate of perceived exertion. Then patient is, asked for the warm up for 10 to 15 minutes. Then whatever the exercise being, planned for the patient, and the patient has to perform those exercises for 30 minutes. And after each exercise, the rate of perceived exertion is evaluated, and after each alternate exercise, the heart rate is checked. And after that, once the patient able to complete the 30 minutes of exercise, we'll send the patient for the cool down period for 10 minutes, where the patient can have a small walk and do some stretching exercises. And afterwards, patient is sent for the relaxation therapy. The patient can listen the favorite music and can relax for a while. And later on, at the last, the psychoeducation on stress management, on diet, on weight control, then smoking suggestions are being given to the patient by the cardiac nurse. So this is the process of cardiac rehabilitation in any institute. And this is the way how we also, this process also we follow in our institutes too. In beginning, I was talking about MET values as metabolic equivalent of task. So there are certain the activities which are categorized into within three METs, 3 to 6 METs, and the more than 6 METs. So in initial phase of cardiac rehabilitation, the patient is admitted in the hospital, patient can be advised the activities which comes under the 3 METs, like walking slowly around the home, sitting using the computer, work at desk using the light hand tools, and art and crafting, playing cards, and playing most musical instruments. These activities normally consume less than 3 minutes. So these activities can be recommended for the patient in first and second phase of cardiac rehabilitation. In third phase, patient can have some moderate type of exercises or activities where it is categorized into in the category of 3 to 6 minutes, where the patient can have a walk at 5 km/h speed. Patient can have cleaning, sweeping of floor, vacuuming, and the mopping of the floor. The patient can have dancing, light swimming, playing in badminton also can be done. So these activities are comes under the moderate type of activities. And vigorous forms of activities which comes more than 6 minutes, under category of more than 6 minutes. So these activities can be performed by the patient at the fourth phase and for the lifelong of their entire period, like walking at the rate of 5 km/h, walking at a moderate pace, carrying the heavy loads such as brakes, heavy farmings, and playing the basketball or bicycle on the flat surface, and the moderate swimming. So this is about the MET values of the various activities. This is one of the exercise checklist. Before enrolling the patient into the exercise program, all the parameters are being checked, and if the patient is experiencing any symptoms are being also recorded. The blood pressure, heart rate, and blood sugar are being recorded before enrolling into the exercise program. The patient is sent for the warm-up period, warm-up phase, and then main sessions are being carried out. And then afterwards, the cool-down sessions are being done for 5 minutes initial phase, and later on 15 minutes. And then after the cool down period, the checkout time, at the time of checkout, again, same parameters are being checked of the patient. And this particular, the file and this format, the patient, we just keep it with us, so that every time when the patient is visiting the cardiac rehabilitation center, we could see the progress of the patient on the basis of the patient, parameters. And this is one of the physical activity diary which normally give to the patient, so that whenever the patient is performing any type of activity and experiencing, the patient can we also teach the patient to how to take the heart rate and how to measure the rate of perceived exertion. So these parameters he can record whenever he's performing any activities at home, and when he comes for the follow-up to the CR, he can bring that particular activity diary, and then on the basis of that, then if any variation in exercise being done, that can be done on the basis of the parameters which the patient records in the activity diary. Finally, at the last, along with the exercises, the another psychoeducation components are there, which is walking program. Like the nurses, the cardiac nurse, they normally deliver the sessions on walking program, the smoking suggestion, and the limiting beverages. And we advise the patient to opt for any non-caffeinated beverages. Then dietary management. So of course the diet plan being prepared for the patient, and this the balanced diet, the plan is normally told to the patient, normally tell the patient to follow the balanced diet plan. Then weight management strategies are being taught to the patient. The diabetes management strategies are also being taught to the patient in the psychoeducation component. Stress management sessions are being taken for the patient. Then medication, how to adhere with the medication regime, and the medication adherence is the importance of adhering to the medication regime is very important. That also been taught to the patient. And finally, the day of follow-up also been decided for the patient. And every time the same day, patient had to come for the follow-up to the, of course, to the cardiologist and as well as to the cardiac rehabilitation. So this is all about the cardiac rehabilitation program, and it's a practical approach. We have prepared a small video on cardiac rehabilitation at AIIMS Rishikesh that I will be showing in just a while. Wait a minute, 2 minutes.
What is cardiac rehabilitation? It is the sum of activities by which patients with cardiac disease, in partnership with a multidisciplinary team of healthcare professionals, are encouraged to support, achieve, and maintain optimal physical and psychosocial health. Cardiac rehabilitation encompasses of 4 phases, that is, phase 1, in-hospital patient period, phase 2, post-discharge pre-exercise period, phase 3, exercise and education program, phase 4, maintenance phase. In these phases, phase 1, 2, and 3 are supervised phases, while phase 4 is unsupervised one. Encourage early ambulation of the patients and involve family members in this activity. The frequency should be of 3 to 4 times per day, and gradually the distance of walk should be increased by 30 to 50 meters daily. Do not force yourself to walk, and if any kind of discomfort is felt, kindly take rest.